Merci, Monsieur le Président.
Thank you, Mr. Speaker. Minister of Health and Long-Term Care.
The migrant crisis, which is unfolding as we speak across Europe and beyond, as tens of thousands of refugees seek freedom and security and recognition as being part of the human family. I start, Speaker, by offering our deep condolences on behalf of all members of this legislature to the family of 3-year-old Aylan Kurdi, brother Ghalib and mother Rahana, and to the countless other families who are like them and those who will be like them. Speaker, given this global tragedy, the time to respond, to pledge support, to act is now. I think, Speaker, that has been, until very recently, the Canadian way of doing things. Whether you're an average citizen, an elected official, a community leader, a responsive premier, or a reluctant prime minister, we can all work together to address this human crisis. Minister, can you please tell us about the...
Thank you. Minister of Health, Long-Term Care.
Thank you very much. I want to thank the member from Etobicoke North for this very important question. Mr. Speaker, I was proud to be at the Premier's announcement on Saturday, announcing $10.5 million for the Syrian refugees, many of which will come to Canada, but also that $2 million of that is allocated to helping refugees in the region. Mr. Speaker, the federal cuts that they made a couple of years back to the interim federal health program left our refugee claimants in this province and across Canada unprotected and put our doctors in an untenable position, Mr. Speaker, forcing them to choose who should be treated. And as we all know, the Federal Court of Canada, the Supreme Court, struck down the changes to that interim health program on the basis, Mr. Speaker, of being cruel and unusual. And they required the feds to reinstate health care to refugees. Mr. Speaker, the Supreme Court recognized that it was cruel to deny insulin to diabetics. And Mr. Speaker, it was cruel to deny cancer treatment to suffer.
Thank you. Supplementary.
Thank you, Minister. Firstly, I commend you on your own personal, globally recognized medical service of refugees, and know that you strive to implement that vision of the Premier and her government here at home. Sadly, Minister, as you cited just now, it can in fact take the Supreme Court of Canada, or at least the latest polling, to extract, induce, or manufacture such behaviour from the current federal government. It took a court decision to remind and reconfirm for the feds what we have said all along, that our healthcare system, indeed our country, should reflect fairness, compassion, and humanity, offering medical care to all our residents, old or recent. Our government believes in one Ontario, an Ontario that protects people living here, not chosen by postal code, riding income, or any other demographic that you care to parse. Minister, would you please inform this House what has our government and your ministry done to address these concerns?
Minister.
Well, thank you. Thank you again to the member from Etobicoke North for the opportunity to discuss how Ontario is acting to address the health cuts that were made by the federal government. Our government reinstated access to essential and urgent health care services for refugee claimants through a program called the Ontario Temporary Health Program. And not only was that, Mr. Speaker, the right thing to do, the humane thing to do, but it also reflects our commitment to evidence-based decision-making, because it keeps all Ontarians safe and healthy. To date, Mr. Speaker, our government and my ministry has spent nearly $2 million on this program, helping our refugee claimants get the health care they need and deserve. Quite simply, waiting until a patient needs emergency care is more expensive. More importantly, Mr. Speaker, it fails the patient. We call on the federal government to end their appeal of the Supreme Court decision and restore full and essential medical coverage for these vulnerable refugees.